Hey guys, and welcome to the second video of Physio. Today I'm going to be talking about what physiotherapy is and what they do. Firstly, let's start by understanding the word physiotherapy. Physiotherapy can be split into two words, phys and therapia. Both of these words are derived from the Greek language. Phys means nature or natural. Therapia means healing. Now bring the two words together and you get the literal definition of physiotherapy: natural healing. Both the Chartered Society of Physiotherapy and the World Confederation of Physical Therapy have similar definitions. They state that physiotherapy helps to restore movement and function to those limited by disease, disability, or illness, which is a simple and great definition because it encompasses everything a physiotherapist would aim to do. One that I tend to use is that physiotherapy helps to improve one's quality of life, and this tends to stick with them because it's so powerful. Physiotherapy is vast, it's huge. Some of you, or the majority of you, may already know that we see patients who have had an ankle sprain, torn ligaments, or for example a frozen shoulder. But did you know that we also see patients with neurological conditions? For example, those that have had a traumatic brain injury, those that have had a stroke, and also those that have multiple sclerosis. How about those with a heart or lung condition, such as those with cystic fibrosis, COPD, or asthma? And these are only the popular core areas of physiotherapy. Some of the other interesting fields are cancer, critical care, trauma and elective orthopedic, sports, women's health, burns, amputee, military, and even animal physio. Yes, there's really a physio for animals. Unfortunately, these are the only ones I can think of at the minute. But hopefully it's made you understand that there's a lot more to physio than you think. For the next part of the video, I'm going to explain what a physiotherapist does. The first time you see a physiotherapist, he or she would undertake an initial assessment. Here is when the physiotherapist will gather all the information necessary regarding your reason for attending. For example, a patient is complaining about ankle pain after overstretching and twisting the foot whilst playing football. The therapist would then ask more questions regarding his mechanism of injury, or for example what makes it better or worse, or how painful the injury actually is. Then they may get a bit more hands-on to assess pain, temperature, range of movement, muscle power, or any other special tests they may have. This will all help the therapist to lead on to the next part, which is to examine the findings and formulate a treatment plan. Let's say, for example, back to our scenario, the therapist has diagnosed an anterior talofibular ligament sprain. Depending on the stage of the injury, the therapist may recommend PRICE, which is protect, rest, ice, compress, and elevate. Or if the injury is not actually that acute, they may provide some exercises. The next stage is to assess to see if any improvements have been made using outcome measures, such as increasing range of movement or increasing muscle power, or for example, being able to play football again. If the outcome measures present with negative findings and has shown no improvement, then the therapist would have to go back to examining his findings and start again. If improvement has been noted, then the therapist will provide a self-management plan such as exercises to help prevent or reduce the risk of a repeated injury. And that is generally how you would spend your time with the physiotherapist. So that's it for this video, guys. Hope you've gotten a slightly bigger picture of what physiotherapy is and what they do. In the next couple of videos, I'll be talking about specific conditions. Therefore, to make it simpler for the wider audience, I'll be categorizing it as such. Musculoskeletal will be under muscle and bones. Cardiorespiratory will be under heart and lungs, and neurological conditions will be under brain and spine. Thank you very much, guys. Be sure to leave a like, comment below, subscribe to follow for more content. Take care, and I'll see you later.